evening, I'm Riza Diaz. This is One News Now. Medical workers are appealing to the government to revert the nation's capital to ECQ until August 15. Let's get the rest of that story from Faith Del Mundo.
During a virtual press conference, health professionals pointed out that they are already worn out from treating COVID-19 patients in hospitals.
We propose that the 2-week ECQ be used as a timeout to refine our pandemic control strategies, addressing the following urgent conditions or problems.
Medical frontliners are bearing the brunt of the public health crisis and they're asking for a timeout.
Kumakaunti ho kami dahil sa dami ng infection, marami sa amin ang nai-infect, may mga namamatay pa po. So, tulungan niyo po kami, ayaw ho naming bumigay, pero kapag hindi ho nabigyan ng karapatang measure, we are just asking for a timeout. Pagod na po kami. Hindi lang po physically but mentally as well. Madami rin po sa amin na nagkakasakit ng COVID-19. Hindi po kami nakikipaglaban sa gobyerno. Baka akalain ng iba na nakikipaglaban ho kami sa gobyerno. In fact, we are one with government dito sa giyera na ito. Kaya kami po ay nananawagan na sana po ay pakinggan ninyo kami. Ibigay ang timeout na ito. Ilagay natin ang DOH as the lead agency na siyang kukumpas sa direksyon, sa estratehiya na gagawin natin. We have to act as one.
Rising COVID cases among health workers has forced Ospital ng Maynila and Caloocan City Medical Center South to temporarily shut their doors.
The health sector cannot hold the line for much longer. If the health system collapses, it is ultimately our poor or the most compromised.
They're also calling on the government to consolidate efforts and come up with a definitive plan of action on the lack of hospital workers, contact tracing and isolation, as well as social amelioration. They're also putting forward the need to require companies to ensure that the workplace is a safe haven for employees to prevent clustering of the disease.
Dapat kasi mayroong isang malawakang pag-analisa kung ano ba yung tunay na nangyayari. Hindi yun naniniwala lang tayo sa mga sabi-sabi.
They also cautioned the government against easing quarantine rules. They urged the anti-COVID task force to place Mega Manila under enhanced community quarantine until August 15.
In relation to this, we also appeal to your good offices to reconsider the pronouncement of the Department of Trade and Industry regarding the approval to reopen businesses such as gyms, fitness centers, tutorial services, review centers, internet cafes, pet grooming services, drive-in cinemas.
Vice President Leni Robredo is supporting the medical community's request for a timeout to recalibrate strategies against the coronavirus disease. But Malacanang rejected their plea. Presidential spokesperson Harry Roque noted that the strict lockdown has served its purpose and that the community quarantine alone is not sufficient to control the virus. He also emphasized the local government units have already been directed to implement a strict localized lockdown in barangays where 80% of cases are located. Roque, however, stressed that President Duterte is listening to them and has directed the IATF to act on their concerns immediately. DTI Secretary Ramon Lopez also shunned the proposal, placing the Metro back under ECQ. He worries that doing so could lead to job losses that could have long-term effects on food and education. The Department of Health may be acknowledging the sacrifices and challenges that health workers face during this time, but it doesn't say if it agrees with their proposal. The DOH instead is appealing to the public to follow current health protocols to avoid overwhelming the country's healthcare system. But the agency says it's talking with medical frontliners to come up with solutions that benefit all sectors. For News 5, Faith Del Mundo, we are One News.
Meanwhile, Health Secretary Duque has just released a statement regarding the doctor's plea. He promises to do more for health workers, such as providing accommodations, transportation, protective gear, food, and pushing for better pay. Duque assures healthcare professionals that he will bring up their request for a timeout to the interagency task force. He also vows to present a better strategy to protect the medical frontliners. Now here are other stories we're keeping our eyes on. Senator Cynthia Villar draws flack after dismissing calls by medical frontliners to revert Metro Manila to its adjacent areas to ECQ. In a radio interview, the senator said health workers should simply do better at their jobs. She's against shutting down businesses because, according to her, if people won't die of COVID-19, they might die of hunger instead. The lawmaker also said that the government could build more facilities for asymptomatic patients and mild cases. Now, after having more than 50 donors at the Philippine Heart Center, the Alagang Kapatid Foundation amassed another 169 blood units, this time at the Los Baños Municipal Hall in Laguna. The Alagang Kapatid Foundation thanks those who participated in the blood drive. And Hong Kong's first temporary COVID-19 hospital is now operational. The Special Administrative Region converted a site for the World Expo into a 2,000-bed facility. It has admitted its first 20 patients today. Hong Kong has reported over 100 new cases for several days now, so the government set up the temporary quarantine center to curb the spread of the virus. For more updates, follow News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.